There's been a lot of different types of innovative research that have come into the fold in neurology over the last 10 years. Neurology has really gone from a diagnostic specialty to a therapeutic one. Obviously, every single conference that we go to, we see a lot of different new innovative research. So, talk a little bit about some of the women-related or women-specific research themes that you feel as though are of the greatest importance right now and are going to be the greatest importance going forward. Just talk a little bit about things from the research side perspective.
Well, I'll just say that I do predominantly ALS research, and in every study that has ever been done, there are many more men than women who are enrolled in trials, and I think that is reflective sometimes of the investigator themselves, and people align or connect with physicians who potentially are their same gender. So having women engaged in research, I think, will facilitate more women wanting to enroll in trials. So that's probably the only context in which I've had a role in promoting women in research, but it's certainly something that we're very concerned about because there are many trials that don't have enough um, people that are, Hispanics, blacks. Most of our study populations are white men, and so I think we need to really do a better job at that.
And I also want to encourage women to not just think as research as you have to submit an R01 to the NIH with a 2% funding chance, but consider clinical trials that are very rewarding. And I do them in movement disorders, you do ALS. But patients come to an academic medical center to be enrolled in something that could be potentially curative or be more helpful than the existing standards of therapy. And, clinical trials in neurology have really exploded over the last decades. And so being part of that and being a site investigator not only is rewarding for your personal gratification, but it also gives you a diversification of your portfolio and skill set as a physician, which make you very valuable for the department. It is also always good to not only rely on RVUs, but having that effort that's covered by the clinical trial. If you think about it financially, it's something that people sometimes underestimate and say, well, that's only industry spot. No, you will learn about clinical trial protocol development, the business end of trials, and you're offering a great service to your patients as well. So I want you to just kind of consider that.
As a clinician, of course, I mentioned earlier, as an epileptologist, that a big subset of my patients are women, and counseling women regarding issues pertaining to choice of anti-seizure medications or contraceptive use. I'm able to do that because there's pretty good data that's been that we have so far that can back up the information and counseling that I do with patients. So I think having continued efforts towards those topics and women-related issues in epilepsy, but virtually all the different subspecialties in neurology is important, and hopefully they'll gets the attention that it deserves.
I think the other kind of research angle is why are women leaving the workforce in neurology? Because you'd mentioned that we have a workforce shortage. So one of the research efforts of the academy is actually we're starting to do a survey. We're calling it the Leaky Pipe Survey. But why are women leaving the workforce, and what could we do to retain them? So that's another piece of research related to women in neurology, a little bit different, but something that's equally as important.
I think you guys bring up a lot of great points. Dr. Eugene, I know from the epilepsy side, we've definitely seen a lot more new innovative studies kind of looking at obviously women of childbearing years, lactating women, things of that sort. So really, really been awesome. It seems like every single conference that we go to, we see more and more new studies kind of focusing in on that age population and that gender group, obviously specifically. I appreciate all of you guys. I'll give you guys a last bit of opportunity to provide any last comments or things of that sorts. Just give a minute or so of just any last comments regarding the panel or any of the topics that we discussed today. I'll give the floor to you guys.
I think my only comment would be to take care of yourself. If you're not well physically, emotionally, spiritually, you're not going to be an effective leader. You're not going to be an effective parent. You're not going to be an effective provider. And so don't forget that that's a really, really important part of your day, is to take time for yourself.
And don't forget what a wonderful experience you make it for the patient to be your patient. Women are compassionate. women know to not only support the patient, but also the caregiver, and they know that being sick is a family affair. And many of us women in our own families have experienced that, right? Sometimes there's a lot on the woman in the family when somebody gets sick, and we see that in our patients and we recognize it. And I really think our patients are very thankful for that.
And along the same lines in academia in general, so medical students and residents, having role models that are women, where they can come to us for advice, for comfort with questions, and mentorship. I think that that's also very important, that that we're well represented. The number of medical students that are women has been increasing since 2019, and it's more than half of medical students enrolling into United States medical schools now are women. So I think we have the woman power to be able to fulfill those roles in our various departments or private practice settings or what have you.